So Aspen's little, I guess, gift to the dental world during the COVID pandemic is to offer free CEs for any clinician in the dental field. You do not have to work for Aspen. So, traditionally we offer our CEs to our clinicians, but again, during the COVID pandemic, it was just a little something that we wanted to do for the entire dental industry. So anyone can take advantage of this. Hop on. The website is aspendentalce.com/welcome, as you can see on the screen here. And, you could just take the opportunity to get some free CE courses. So just wanted to let everybody know about that. Okay, so we'll get started. We have a few people on. Anyone else can catch up with us in a little bit. 7:02, so we'll get going. My name is Melissa. Thank you so much, everybody, for joining us. I am with the specialty team at Aspen. Officially, I'm on the academic team, which means I work with the schools and the residency programs. So kind of like being a liaison between Aspen and the residency programs. But being that we're in the middle of this COVID pandemic and I'm unable to travel, I'm mostly working from home. So I'm not really visiting with the programs at the moment, but we hope to get back out there soon, because as much as I like doing these events, I'd much rather be sitting with you guys and talking face to face and, having a meal or a drink together. So hopefully we'll get back to doing that at some point. It's Friday night, so if anybody wants to grab a cocktail, I'm not much of a drinker, but it's been a very long week. So I do have my glass of Moscato here. So feel free to grab a cocktail, grab a beer, whatever. This will be very informal. For all of you participants, you can drop your questions. There's a little chat Q&A button at the bottom of the screen. So you can type in any questions that you have there. You can choose to submit your questions anonymously if you prefer to do that. And then as the questions come in, I will read them out to Dr. Elliott and he will answer them, or I will answer them if it's something that I can answer for you. I kind of go back and forth. So if you see me moving all around and looking in different directions, I have multiple screens set up here so that I can see the attendees, the questions that are coming in, and see Dr. Elliott at the same time. So if you see me kind of looking all around, I'm trying not to be rude. It's just I have to kind of look at what's going on from all directions. It's like mission control over here. So that's my background, my introduction. Dr. Elliott, a little bit about yourself, how long you've been at Aspen, and just introduce yourself.
Good. So I'm Ed Elliott. I'm an oral surgeon with Aspen Dental. I've been with Aspen since 2017, so just about 3 years. I did my undergrad at Lafayette College in Eastern Pennsylvania. Then I did my dental school at Temple University in Philadelphia, and then my residency at St. Joseph's Regional Medical Center in Paterson, New Jersey. I did work in private practice, just your normal traditional oral surgery practice for 1 year, and then I switched over to Aspen Dental after that, and I've been with Aspen ever since.
Nice. Well, thanks for doing this for us. We appreciate it. Dr. Elliott and I are both New Yorkers. I'm in the city, he's upstate, so we're kind of neighbors, but we haven't met yet, and hopefully one day. So someone just submitted that they did submit some questions through the portal previously before we started the session, and I did get them, so I will get to your questions. Guys, please use the chat, use the Q&A, type whatever questions you have, and we will get to as many questions as we possibly can. So the first thing I like to do is kind of explain what exactly a DSO is and give a little bit of a background on Aspen, because sometimes I think, like Dr. Elliott, you and I working in this environment, we take for granted that I guess everyone else out in the world knows what we do. And sometimes that's not the case. So I always like to give a little story. If you are a general dentist, let's say, and you just graduated dental school and you want to start a practice, well, what do? Well, the first thing you probably have to do is go to the bank or a loan officer to get some money, right? You have to pay student loans, and it's probably going to cost you quite a few bucks to open a practice. Then you're not a real estate agent, so you might have to find a real estate agent to help you find a place, a lawyer to help you with the lease. Then you have to get your network set up, and you have to hire an IT guy that can set up your network in a HIPAA compliant way and get all of your equipment in as far as your computers and all your technology that you're going to need. You have to set up payroll, so you may need to hire an accountant or a payroll service. How are you going to get patients? You have to now hire a marketing company to let everybody in the neighborhood know that you're open and to get patients in the door. You need to find a supply vendor, so you have to go to Henry Schein or Patterson or whoever it's going to be to get your supplies in. Then a couple months go by and maybe the business isn't where it's supposed to be, so you hire a business consultant to come in and help you out with that. So you guys can kind of see where I'm going with this. There are so many things that have to be done when you are a practice owner, and the beauty of working as a practice owner at Aspen is that Aspen helps you with all of that. And we've done it for almost 900 offices across the country. So we have a team of experts that have done this 900 times. And so it just makes it a lot easier for the dentist to be able to, transition into owning a practice. Our practices are owned by general dentists. So I work for ADMI, and my company is the corporate side, but we do not have ownership in the offices. The general dentists own the office 100%, and then we just provide all of those services that I just, kind of went over. And that's just like the tip of the iceberg. There's probably 1,000 other things that we do for the offices, but we provide that service and support for anything that's not clinical in the office. So just to kind of get that out there, so everyone understands why a clinician would want to come over to Aspen. Do you have anything to add to that, Dr. Elliott?
Yeah, absolutely. As I said before, I did work for a year in private practice, doing the traditional oral surgery practice. So I can't really speak from what the ownership looks like from a general dentist perspective, but I can definitely talk about what the difference is between a traditional oral surgery practice versus working for Aspen Dental. Most traditional oral surgery practices, they offer you partnership after a while, and that does vary from practice to practice. The one that I was working for, the partnership track was about 10 years. Some of them are, 2 years, anywhere from 2 to 10 years. So you kind of have to earn your way toward being a partner, and then at that point, that's when you start to make the partner salary and kind of make decisions, on how the practice is running. So at Aspen Dental, it's a little bit different. You just come in and essentially you're managing your own schedule right off the bat. You sort of decide what procedures you want to do, what you don't want to do. Another main difference is that you're traveling. You're essentially a traveling specialist. So you do go from office to office each day. I cover 8 offices, and so I do 4 in 1 week, 4 the next week. So I'm in every office just about every 2 weeks. So it means that I do travel with some of the equipment that I work with. There is some equipment that I just kind of leave in the office, but I do travel with a lot of it. So that's certainly different than being in just one office where you come in and you basically everything is already set up. So there are certainly some differences that I will certainly go over. If people have more questions about that, but essentially, it's just the traveling aspect of it is certainly something that's really quite different, and the setup is a little bit different because of that.
Yep, and I'm sure we have questions coming in about that. So you mentioned that you do travel with some of your equipment. So let's go over equipment because we have a few questions about that. So what equipment does Aspen provide for you?
Mm-hmm. So I do have the Bien Air surgical handpiece. It's used for both implants and wisdom teeth. It's just your standard Bien Air handpiece that's iPad driven. We have a nitrous mixer that we use. Basically, that's how we provide nitrous for patients. So I travel with that small nitrous mixer. And then, you know, I do like to travel with some of the, you know, some of the trays that I use, you know, with different forceps and elevators and everything that I use, and you know, basically to see, you know, each patient, each and every patient. Aspen does provide the vehicle as well, that you kind of pack all this equipment into. Now, like I say, some oral surgeons don't really travel with that much equipment. They just kind of stock every office with everything that they need, and they just travel with the minimal stuff they have. So it's, you know, you have the choice to decide exactly what you want to do with that. And so I mostly travel with all my stuff, most of it anyway, from office to office. The only thing I don't travel with is medication. Each office is supplied with a lockbox, where you can lock in all the controlled medications that you use for sedation. So I don't travel with medication, but I do travel with most other things I use.
Yeah, and no one travels with medication, right? That's part
Yeah.
of DEA regulation. So, yep. So do you have use of a cone beam?
Yes, we do. So right now, the plan is, you know, to have every Aspen Dental office with a cone beam CT, because they're trying to push certainly to have more implant cases, and you know, having a cone beam CT in every office will certainly help with that. But as of right now, out of the 8 offices that I cover, 2 of them have a cone beam CT, and so if a patient in any one of the other 6 offices needs to get a CBCT done, they just really have to travel to one of those other offices, one of the 2 offices with the machine, and then, you know, I can look at the X-ray. I can look at any radiograph on the electronic system from any office, but they'll have to physically go to one of those 2 offices.
Yep, and I can also add to that, you're correct. There is a big push from ADMI to make sure that every single office has a cone beam. It was supposed to be by the end of this year, but COVID kind of had other plans for us in that regard, as well as many others. I'm sure we'll get to some COVID questions later. But so by the end of next year, every office in the Aspen network will have a cone beam, which is really nice, as you mentioned, for an oral surgeon to have access to at every office. Let's see. So do you get to choose your equipment and supplies? And can you choose what you, so I guess it's a similar question, but in 2 parts. Can you choose what you want to use? And does Aspen have preferred brands?
Absolutely. You can certainly choose whatever you want to use, you know, whatever you're comfortable with. That's what you go with. You know, I use the BN Air NP just because that's what I used in my residency. And that's what I'm comfortable with. That's how we did our dental implants. So, but really, whatever you're comfortable with, you can certainly feel free to get it. You know, whatever makes your job and your life easier. There certainly are preferred providers. You know, case in point, you know, if you're talking about dental implants, we mostly work with Nobel. Nobel Active is the implant that I place, but Nobel BioCare is the preferred provider for most of our implants that we do. So you could certainly choose to use a different provider if you like, but just from a purely financial standpoint, from a cost effectiveness standpoint, it's better to kind of use the provider that supplies the entire Aspen chain, because then you can get different deals based on that, and so that's really why I mostly use the same providers that Aspen works with. But you can certainly choose to work with whatever you're comfortable with.
Yep, and that's a great point. So Aspen is actually Henry Schein's largest customer outside of the US government. So we get some pretty nice discounts, and there are some preferred brands that we get better discounts on through Henry Schein. But I've had doctors, you know, say on lots of these calls that, you know, there's a particular piece of equipment or a particular supply that they will only work with a certain brand. And guess what? Aspen will get it for you. So you never have to worry about that. Of course, there's benefits to using, like you said, what everyone else is using. But if you really wanted something, you'll get it. It's completely up to you. So you actually touched upon this. Are you able to access patient records when you're not in the office?
Yeah,
So,
absolutely. It's a great system. It's called EPMS, and you can certainly access it from home, just from a laptop. I think you can certainly use an iPad or a phone as well. I haven't really set my phone or iPad for that, but I do have it set up on my home computer. It's a great way to, especially for traveling specialists. You want to be able to just easily access records from wherever you are. So I usually call every patient that I did any kind of surgical procedure for at the end of the day, and I just basically go into the EPMS system. I can see exactly who I saw today, what I did for them, what I prescribed for them, and I can see my notes from earlier, and then I can give them a call just to check and see how they're doing. I can use the system to look at X-rays. As I was saying before, there's only 2 offices with a Columbium CT. So if I need to take a look at a CBCT for a patient, I can do that from home. I can, I can prescribe from home if I need to. If the patient needs, extra pain medication or something over the weekend. Most pharmacies really, certainly in New York, they won't allow you to call in anything, so you have to do it electronically, and you can do that from home. So it's a great system that we have that allows you to really keep a close tab on what's going on with your patient and stay in the loop.
that's awesome. And I would imagine that's probably really good for like planning out your day when you're going to an office prior to going to the office, especially since you're not in those offices every day.
Exactly. I mean, if I want to see what I'm doing tomorrow, next week, if I need to look at health histories, to see what exactly what kinds of patients I'm seeing for that day. That brings a different point as well. Do I do consultations for patients before I see them? That's usually a question I get when I go to when I talk to residents.
So you read my mind.
What's that? Oh, good. Yeah.
You read my mind. It's on this list.
So if it's a completely healthy 17-year-old patient, wisdom tooth extraction, which is really our bread and butter as oral surgeons. I usually don't do a consultation prior to seeing the patient. I do a consultation that same day when I see the patient. Usually the general dentist is the one that sees this patient, and they sort of can kind of filter out who the healthy, ASA1, ASA2 patients are that can just be seen for a consultation that same day. If there's a patient with a more complicated health history, then I typically require a consultation prior to the date of surgery for that. If it's like a more complicated procedure, if I'm doing a big implant case, or if it's a pathology case, then absolutely I want to see that patient for a consultation prior to the actual surgery date. But in general, for most simple things, in a healthy patient, the general dentists really are the screeners. They kind of screen who the healthy patients are, and then I do my own consultation on the day of surgery.
Awesome. Yes, that is always a question that is asked. Every single one of these, somebody asked that question. And while we're on the topic, because typically this is a question that comes up as well about post-op care for the patient. Can you speak a little bit about that?
Absolutely, yeah. So for most of what I do, I don't do orthodontic surgery cases. I don't do big TMJ cases. Most of what I do is just really dental alveolar and a couple of pathology cases. So for that, fortunately, the complications are pretty rare. You get a patient once in a while with dry socket. You get a patient who may have an infection here and there. So for dry socket, really, that's a pretty simple thing. I usually just have them, they can see the general dentist in the office where I saw them, and they can usually manage that pretty easily. If it's something that's a little bit more, more involved and the general dentist is not able to see it, sometimes I can drop by that office at the end of the day, or the patient can travel to whatever office I'm in. But like I said, it's pretty rare. can't remember the last time I had to go back to see a patient in an office or a patient had to travel to come see me. Usually it's something that's pretty straightforward that our general dentists are able to manage. And if you build that relationship with your general dentist, they are more than happy to accommodate that for you.
Yeah, and that's a really good point as well, kind of bringing another question that came in. So with the referrals, I know you do, our oral surgeons do take some outside referrals, but a lot of the referrals do come from within the Aspen network from the general dentist. So as you just mentioned, you have a much better relationship with these dentists because you're working in the office with them on a weekly basis, monthly basis. So I think that, you know, you can kind of build a more, a comfort level with them where they know what you expect, you know what they expect. So I think that's really a nice part about working in the office with the general dentist.
Absolutely. I think, you know, that's huge. When I, you know, the 1 year that I was working in private practice, you know, you're working with the dentist that's 40 minutes away, 45 minutes away. So if you have a big case that really requires a team approach, it's certainly a little bit more difficult to work on that than working with someone that's just across the hall and you can just go in and, you know, basically pick each other's brain. Yeah, so really these general dentists really, they become your, you know, your colleagues in you know, the closest sense of that word that you can think of. That you work with them essentially every day that you go there. You see them every day. You know, you see each other after work. You essentially become friends with these people because you work with them every day. And it's very, very easy to build that relationship. And there's marketing. When I was working in, you know, in private practice, you know, a big part of my day was spent marketing, going around to general dentist offices, you know, bringing a box of donuts and you know,
cookies, donuts, coffee.
Yeah, so you know, I don't have to do any of that, and you know, for a person like myself, you know, I like doing surgery. I'm not really a big marketing person, so I something I struggle with, and at Aspen Dental, I feel like I can focus more on what I know how to do, which is doing surgery versus, you know, being a marketing person.
You mean you didn't get a minor in marketing when you were in school, Doc? Come on, you're only an oral surgeon.
Yeah.
No, but you're right, and I think that's something that, you know, when you're a resident, especially, like, these are the things that you don't really think about because, you know, you're just so focused on completing residency and learning everything you can, and that's great. But, you know, then when you get out in the real world, like, you have to get patients in your chair,
Exactly.
or you are not able to do your job and make money.
Yeah.
So that's
exactly
definitely
right.
a huge point. And I also think it's nice because, you know, you touched on the fact that you guys become friends. And I always say if you put 10 dentists in a room and show them the same x-ray, you'll get 11 different treatment plans. And that's the truth, right? So in a case where you were working for like a private oral surgery practice, well, if you had a discrepancy on a treatment plan, you have to call the dentist, he's with the patient, you can't get him on the phone, you send an email, you send a text, you know, all the while the patient is sitting in the chair, right? And you're saying, why did they send this person to me?
Exactly.
But in Aspen, you just walk down the hallway and you say, hey, Doc, come here for a second. And then you guys can kind of hash it out in the hallway together and come up with what's going to be the best plan of education.
And that brings a really important point as well. You know, another question I sometimes get is, you know, whether you have control of the treatment plans that you do, and you certainly do. No one else treatment plans for me. I treatment plan all my own cases. You know, you allow the general dentist obviously to kind of do the initial treatment planning, and if it's a patient that you're not going to see for a consultation until the day of surgery. But at the end of the day, it's your dental license, so you certainly have to make sure that you agree with the treatment plan before you provide any kind of treatment. And so if there's anything I don't agree with, I usually either talk to the general dentist and see if there's a different way that we can approach the problem. But I've never treated a patient when I did not agree with the treatment plan.
So that actually is a great transition to, I'm just switching screens here, one sec. A question was submitted prior to the session. And the question was, Do you feel pressured or overworked in any way? Really, do you feel pressure to do treatment that is unnecessary, which I think is a really good transition from what you just said?
Absolutely. As I said, at the end of the day, it's your dental license, and you are the one that's deciding what sort of treatment you want to provide for the patient. No one else makes that decision for you. So I don't feel pressure to do anything I don't feel comfortable doing. Everything that I do, it's work that I know I've done before, I'm comfortable doing. If there's anything at all that I don't like to do, as I mentioned earlier, I don't do orthodontic surgery, I don't do TMJ cases. I do some pathology cases, but I do not do big reconstruction cases. Again, because there are some docs in my area who do that on a daily basis, and they're certainly more versed in doing that now than I am. I did some of that, a lot of that stuff in residency, but I certainly don't do that in private practice anymore. So I don't feel pressure to do any of that stuff. If it comes in and I don't want to do it, I just kind of send it out and it gets seen somewhere else. So, and as far as my schedule, I have full autonomy on my schedule. I tell them exactly what days I want to work. If I want to take a couple of days off, I can take, days I want to take off. But essentially my schedule really is based on what I want to do. If I want to see 10 sedations a day, I'll do 10 sedations. If I want to do 5 sedations a day, I'll do 5 sedations. At the end of the day, if you're a new oral surgeon coming right out of residency, you want to start slower, just so that you can kind of make sure you're doing the best you can for each patient. And then over time, you kind of start to see more and more patients because you feel more comfortable doing it. That's certainly how I did it. My first year, I was basically getting, an hour for every wisdom tooth case because I wanted to make sure that I can see the patient, start the sedation, get the procedure done, and then make sure the patient is basically safe the whole time. I had new assistants as well that didn't know much about oral surgery, so I wanted to make sure that all those things were taken care of. But now that I've been doing it for 3 years, I certainly can see more. I can see patients in more frequent intervals than that.
Yep, makes total sense. And that's pretty typical, I think, for any clinician, right? You get more efficient as you get more comfortable. So that, again, a good transition into the next question. How has Aspen helped you grow your surgical skills? And do you feel that they give you proper support to take cases to an operating room or still have hospital privileges if you feel that that's necessary for the patient?
Absolutely. I do have privileges at the hospital close to me, close to St. Joseph's Health Center in Syracuse. I think in order to be board certified, you actually have to have privileges at a hospital. So they certainly support that. As far as helping me grow as a surgeon, I mean, we do a lot of CE courses that are provided by Aspen Dental. We do the leadership conference every year where there's a whole bunch of CE courses that we take that are specifically geared for specialists. Going back to the point of what I do in the hospital, and what sort of procedures I do. As I said, most of what I do is just dental alveolar. I don't do a lot of the big orthodontic, TMJ cases, and a lot of that stuff will certainly require going to the hospital every day. But with the dental alveolar stuff that I do, I mostly try to spend as much time in the office as possible. It's more efficient to do it that way. You can imagine if you try to do a wisdom tooth case in the hospital, by the time you get there, get your OR stuff set up, get the anesthesiologist there. By the time you finish all that, it's 3 hours, 3.5 hours, and you could have done 4 cases in the office. So it's certainly more efficient to try to do as much as you can in the office. Now, there certainly are some cases, patients who are, compromised health histories and things like that you probably would not be able to do in an office, but I try to do as much as I can in the office.
Sure. So I love this question. This is something that I talk to all candidates about. So whoever posed this question, you read my mind. So in recent years, more general dentists are trying to expand their surgical capabilities by doing more procedures themselves. How do you feel this impacts your ability to earn and produce as an oral surgeon with Aspen? How does it affect your referral base? You know, implants, they mentioned third molars, things like that. So that's something that we kind of touched upon before with the built-in referral base, right, from the general dentist. Before you jump in to answer that, this is something that I do bring up to every candidate that I speak to, because when I was working outside of Aspen for the 2 or 3 years prior, I worked for a dental supplier. And so my customers were general dentists and every kind of specialist that you can think of. And I used to ask them, what's your biggest headache? What's your biggest worry? What keeps you up at night? And the number one answer I would get from every specialist across the board is getting patients in the door. Because that is the truth, right? The referrals are not what they used to be from the general dentist to the specialist. That has a lot to do with technology, because as technology evolves and it makes it easier to do certain things, the general dentists are able to do them. Now, whether or not they should do them, right, that's another story, but they think they should, and they want to keep the patients in-house. What I love about the Aspen relationship is the general dentist owns the practice, so they are still making money from the procedures that you, as the oral surgeon, are doing under their roof. And if they can see, you know, 3 or 4 new patients in the amount of time that it's taking you to do a procedure, well, that's a win-win for everybody, because you're the specialist, so you're giving the patient the best care. The general dentist is keeping their patient in their building and not referring them out. And they're getting to see patients and make money alongside of you. So to me, that's kind of, you know, that's a great question, because yes, that is the truth. But I feel like in the Aspen model, you know, the relationship just works so much better.
Absolutely. Yeah, you know, like I said, I don't think having a schedule that's not full, that's not a problem that I've had at Aspen Dental. My schedule is really, I have to limit, you know, what they're putting on my schedule, because it's really, so it's not an issue that I really dealt with at all. You know, general dentists would prefer you to do, you know, a big full mouth extraction case, because the patient is more comfortable. You're able to sedate the patient. So the patient is happy, everyone is happy. I don't have any general dentists that do wisdom teeth in my area, certainly not impacted wisdom teeth. You know, they may be 1 or 2 that are starting to do single implants now, the very, very simple, straightforward implant. But in general, the majority of implant cases, they come to me. So it's certainly not a problem that I've seen, at least not in my area here. The general dentists that I work with, they're certainly much happier to let me do something that, if I'm going to provide a better service for the patient, they'll much rather have that, because again, it does affect their bottom line as well.
Yep, absolutely agree. So how many oral surgeons are at one Aspen location? The answer to that is 1. So that's another nice thing about the Aspen model versus some other DSOs. It's your office. You're the only oral surgeon in that office, which I think is nice for obvious reasons, right? Are your assistants dance certified?
My 2 assistants are dance certified. They're BLS certified. I think those are just 2 basic things that every oral surgery assistant should have in this day and age. But yes, mine have dance certification and BLS certification.
Awesome. How long do you book for your sedation cases? How long do you book for your sedation cases?
Yeah, so, you know, that does vary between procedures. You know, if it's just a single tooth extraction, I give myself half an hour, which is probably more time than you need for a single tooth extraction. But I do like to make sure that you know, everything is running smoothly. I don't ever want to run behind. For wisdom teeth, I give myself 45 minutes, which again, some providers might consider that to be a lot of time, but I still prefer to be able to, you know, work at my own pace where I don't feel like I'm rushed. And then if it's a full mouth extraction case, I usually give myself an hour 15 minutes or an hour and a half, depending on, you know, what the X-ray looks like. So I just prefer to give myself more time than what some providers might. Again, just because I like to not be rushed, and I like to make sure that I'm doing the best work that I possibly can instead of worrying about the next patient. So,
But ultimately, it's your decision as the clinician how you want to schedule your day.
exactly right.
Yep.
So
I
you
think that's the most important thing, I think, for everybody who's listening to really, remember.
yeah, you have absolute full control of your schedule. If you want to give yourself more time, you can. If you want to do less, you can. It's really completely up to you.
So I don't know what this means, but I'm sure you will. How does Aspen facilitate your use of advanced surgical materials? And then in parentheses, it says PRP and BMP, et cetera. I don't
Yep,
know.
absolutely. Yeah, there are some reps that come around and, they work with you if you want to do PRP, if you're doing big bone grafting cases. They usually bring their own centrifuge. I don't own a centrifuge at Aspen Dental, but they usually bring it with them. So there are different reps, whatever rep that you work with in your area, chances are they probably have an office in whatever location you want to work with for Aspen Dental, and they can certainly do all that. I don't think you need to buy a centrifuge or any of that expensive equipment. Usually they just bring it with you if you have one of those big cases. I don't think, I don't do those cases every day. I do one of those maybe once every 2 weeks, once a month. So they just, they just come in and they work with me as I do that. But certainly you can work with any supplier that does that if you want, and it's not a problem.
Is PRP platelet-rich plasma?
Yes, it is.
I did know what that is, but I didn't know that you would use it as an oral surgeon.
Yes, absolutely.
See, I'm learning today, guys. I'm learning right along with you all. So let's see. Okay, how far do you travel to your different offices? So I guess what's your furthest office from your home? Do any require you to stay overnight? If so, is that covered by Aspen? And the last part of this question is, you have the opportunity to move to different offices in the country.
Yes, so I cover 8 offices. The closest one is about 10 minutes away from my house, and then the furthest one is about an hour, 15 minutes away from my house. So I know I don't ever stay in any hotel. I'm usually back home by the end of my work day. Now there certainly are some oral surgeons in some far-flung places in the country. I know some colleagues who work in Alabama and Mississippi, and the furthest office is about 4 hours away, and I know they certainly have to stay in hotels for a night. But fortunately, I don't have to deal with that at all. So you might be able to answer this question.
Yep.
Does Aspen basically cover it if you're staying in a hotel?
Yes.
I'm not really sure.
Yep. So if you have to stay in a hotel, ADMI will cover the cost of that. We try not to do that as much as we possibly can. The malpractice insurance companies don't really like the oral surgeons to be farther than 2 hours away from their home for emergency purposes and things like that. But, in some areas, like you mentioned, Dr. Elliott, where the offices are so spread out, a doctor may have to cover an office that's a little bit farther away. But for the most part, we try not to do that. And especially with new surgeons that are coming on board, I don't think that that's going to be the case for anybody, getting hired at this point, because, again, the malpractice would really prefer us not to do that. So we're going to try not to do that going forward. So we try to keep it within 2 hours driving distance of your home. As you mentioned, some offices will be a lot closer to your home, and you do have autonomy over your scheduling. So you can travel to the farther offices on the days where it's more convenient for you to do that, and you can stay closer to home when it's more convenient for you to be closer to home. Let's see. Sorry, I have questions coming in all different places here. So you mentioned about the type of procedures that you do. A question about, are you doing complex procedures like traumas, facial aesthetic surgeries, which I know you don't. Some oral surgeons choose to do, as far as my knowledge, some oral surgeons choose to do some more complicated procedures. That's just their preference. But you have the ability to do, whatever you want. Do you see children, That's another question that's coming in.
I do, but I do at the cutoff point. I see anyone who's over 5, and I do like to do a consultation for every pediatric patient. I don't ever see the pediatric patient the same day as the procedure. So, but yeah, 5 years old is my cutoff. Why 5? Just because that's the age that we mostly saw in the office when I was a resident. That's what I'm comfortable with. But you certainly can do whatever you're comfortable with. If you feel like you can provide a good service for someone who's younger than that, it's up to you. But I just feel like my comfort level, if you're over 5, that's what I usually like to do. Yeah, what procedures do I do? It's usually just extractions. I usually do extractions. Sometimes, when a kid comes in with an infection, you're doing an IND. But in general, it's mostly extraction of, primary teeth and nothing really that complicated. So if it's a kid that's able to sit for an IV and you can sedate them, or they can get nitrous in the office and you can do what you need to do under nitrous, I usually can do that for them.
Awesome. I love asking that question because I get such a different answer from everybody. I did one of these with Dr. Chisholm. I don't know if you know Dr. Chisholm. And when I said, "Do you see kids?" he said, "No, absolutely not." But again, that just comes back to the same premise that we've been talking about this entire time, right? Like, you can choose to do whatever you want to do.
Absolutely. Some of these kids, you can certainly say, "Oh, I don't want to deal with kids if they are problematic," but why did we get into this field, into dentistry and oral surgery? To help people, right? To help people as much as you can. And if you can help a kid with, swollen, with a decayed tooth, I think that if you can do it safely, and you should be able to do it. Now, you don't have to do it at all. If it's not within your comfort level, absolutely, you don't have to do anything you don't want. But
I think some adult patients are worse than kids, so
absolutely.
I may be one of them. So you mentioned that you did work somewhere else for a year outside of residency before you came over to Aspen. So that's a pretty short period of time. So a question about if you would recommend an oral surgeon to come over to Aspen right out of residency. Do you feel you were prepared to take on difficult cases on your own without an oversight of a mentor?
Yes, it really all depends on the comfort level that you come out of residency with. If your residency program was pretty intensive and you do all kinds of procedures, you do the entire spectrum of what oral surgeons do, and you're comfortable doing it by yourself, certainly I feel like you can certainly come out of residency and just hit the ground running. I know some residency programs don't really do as much dental alveolar as they should, or they don't do as many implants as they should. If that's the case, then you may have to kind of pick up some more of those skills, get more comfortable with doing implant cases, get more comfortable with doing big extraction cases, if you kind of went to a residency program where they don't do a lot of that. But in general, for what I do, again, for dental alveolar procedures and some pathology cases, I feel like every oral surgery resident probably gets enough experience from any residency program in the country that they should be able to hit the ground running. Now, I certainly had the advantage of doing a year where I had mentors. I had 5 other surgeons that I worked with, and so I certainly probably picked up some, a few things that I would not have known right out of residency. But in general, most residency programs will teach you all that you need to know, and we have a nice network of surgeons here at Aspen Dental, surgeons who've been working for Aspen for 15, 20 years, and you can always pick their brain if there's any question on anything.
Awesome. A few COVID questions. Let's switch gears a little bit. Have you seen the practices change at all with COVID? As in, are you seeing less patients than before? Has the office?
Well, that was certainly true earlier on in the summer. I don't know if patients were a little more leery about going to the dentist or what. But as a specialist, my schedule really is not any different than it was in March or February. I'm not so sure if that's the same for the general dentist, or for other specialists. But for me as an oral surgeon, usually we're booking two weeks, 3 weeks, 4 weeks ahead of time, and so my schedule is usually in pretty high demand, and I haven't really seen a reduction in the demand at all. Now we do a few more things, than what we did before the pandemic. We try to give yourself more time for cleaning the rooms, turning over the rooms after each patient. We're certainly using more PPE than we did before. We try to make sure, you have, gown and shoe covers and head covers and shields. Some of the things that I didn't use before. I didn't use, shoe covers. I didn't use a head cover at all before the pandemic, but we're certainly seeing more of that being used now. And we try to kind of maintain, the social distancing in the office, so we don't have the driver come in with the patient anymore. The driver has to stay out in the car. We try not to have too many patients, in the waiting room at the same time. So we certainly try to keep, patients from crowding in any one particular location. And we try to make sure we're cleaning the rooms, much more thoroughly. I mean, I'm not saying we didn't used to clean the rooms before, but now we make it a point to make sure every surface is cleaned. We make sure that every assistant, the doctor, everyone has all the PPEs that they require. So there certainly are a few things that are different now than what we used to see before the pandemic. But in terms of my schedule, in terms of patient demand, I have not really seen a change in that.
You mentioned about using different types of PPE now. Do you have everything that you need in every office? You have your N95s?
Yeah, we have N95s. We have all the equipment that we need. And at no point during the pandemic did we really have any problems with PPEs. We have a department that specifically only deals with acquiring PPEs and all those things. So I never had to worry about it. It was always there for me. So that's one of the really great things about where I am right now.
Yeah, that's huge, because I know, I'm still friends with a lot of the dentists that I used to work with when I worked, with Patterson, and that's not the experience that everybody is having right now. There's a shortage of supplies and, a lot of different things that these dentists are having to navigate kind of by themselves. So I think Aspen, from what I've heard from every single person that I've spoken to in the past few months that works in the office, I think that the general consensus is that Aspen has done a really nice job with supporting the offices through this pandemic,
Absolutely.
which nobody has any experience with, right? So we're all just like doing the best we can.
Mm-hmm.
Do you ever do lunch and learns with your general dentists or your office staff?
I do. I try to do every quarterly meeting with all my my general dentists and all my my office managers, so that we can go over my preferences as far as what my schedule should look like, what procedures I like to do, what kinds of patients require prior consultation. So I try to do a refresher, once every quarter, just to go over that, and then we do a small CE course. Like I might go over Steiner's, oral enteral communication repair. I might go over risk factors for neurosensory disturbances after extraction. I might go over some implant cases. Just something that the general dentist can learn something from that you do every day.
Awesome. And that's another plus about working in the same office with them, right? So a question was just asked, and I think we kind of covered this a little bit in the beginning, but I think, Doc, you might have come on a little bit after we went over this, but I guess we can touch on it again. Who pays for equipment and supplies? So there are certain, I can start. There are certain pieces of equipment that Aspen will provide for you. Any of the larger equipment, for example, we mentioned the cone beams in the offices, x-ray equipment, the hand pieces. But Doc, I guess you can talk more about like who pays for and how do you order your disposables, things that you order on a more frequent basis.
Absolutely, yeah. So the pay structure for Aspen Dental is that you get a percentage of production. So what happens is all the equipment, all the consumables that you use, basically that gets subtracted from the gross production, and then whatever net production is remaining, you get a percentage of that. So, you're sort of paying for it, but you're also kind of splitting the cost with Aspen Dental, I suppose, because the total cost of that is taken care of before the net production number where your pay structure is based off of. So.
Yep, it's a shared cost. And that's why when we spoke earlier about like using preferred vendors where you're going to get the best, the best rate, which obviously you're never going to sacrifice quality just because it's a cheaper price. But, I guess the way it's done, it kind of incentivizes you as the doctor to make sure that you're ordering appropriately. You're not being frivolous with the spending.
Absolutely.
So you mentioned kind of about how oral surgeons get paid. There are quite a few questions coming in about pay. I'm not going to ask you how much, someone wants to know how much money do you make, but you don't have to answer that. Whoever asked that question, I can connect you with Dr. Elliott after the call if you'd like. But
I don't, if people want to know how much I make, I can tell them. I really don't care.
Well, I guess if you could just kind of like give an overview of like what you're making in Aspen versus what you were making the year, I guess, when you started out of residency, and, compared to outside of Aspen, are the oral surgeons making?
Yeah, absolutely. So coming right out of residency, I was making an associate salary. So I was getting paid $240,000 a year, which that was a good amount of money. I mean, for someone coming out of residency, that's not bad at all. And so, as I said before, the office required me to be an associate for about 10 years before you finish the buy-in process, and then after that, that's when you start making the partner salary. So at Aspen Dental, the first year that I came, I left the private office and I started working for Aspen Dental. I made about $700,000 in 1 year, and then the last 2 years I've grossed about $950,000 a year, and it's probably only gonna go up, especially if I pick up a couple more offices. There's another older oral surgeon that's retiring in my area, so I'm gonna be picking up those offices. So it's probably gonna go up. So that's all based off. Again, you can probably talk about this a little bit more, but it's just based on making sure that your schedule is full, which it always is. As long as you have a full schedule every day, you're going to make a lot of money at Aspen Dental, and you don't have to worry about any overhead costs that a private office has to worry about, and you don't worry about marketing. So really, at the end of the day, I just come home, I play with my kids. I don't worry about what tomorrow is going to have, because I know I'm going to have patients tomorrow, and I don't worry about that at all.
Yeah. Seems great to me. I always tell people when they ask the question of compensation, it's, obviously every region is different and the offices are different depending on, what the going rates are in the area, fee schedules and like how busy the offices are. But across the board, oral surgeons in the Aspen Dental Network make well above the national average. So I appreciate, Dr. Elliott, that you were so honest and open with us. And I hope that answered your question, whoever posted that question. But, just know that it is obviously based off your production. So that's going to be different for every provider. And especially when you're coming out of residency, I think you're not going to be as quick your first year or two. So it does go up over the years. But I don't think anybody ever leaves Aspen because of money, not an oral surgeon anyway.
Definitely not.
So I have my last two questions that I end every call with. The first one is, what do you like least about working for Aspen?
Yes, I think the biggest thing really is just the travel aspect of it and how it affects the assistants. Like, I personally don't care about the traveling. Like I said, the furthest office is about an hour, 15 minutes away. But sometimes it's difficult to find an assistant who's willing to travel every day. And so I've certainly had more turnover with my assistants than I did when I was in private practice. And I think that's one aspect of it that I if I could change that, that's what I wish I could. Now that has gotten better over the last year because I've I make sure that I compensate them more than I did when I first started. I give them bonuses as well. So I certainly put some incentives in there to make sure that they love traveling with me. But sometimes it's pretty difficult to hit that sweet spot where you find someone that's comfortable with traveling every day versus going to one office. So I think that probably is the main thing that's a little bit challenging at Aspen Dental. You just don't have that one place where assistants are willing to just go in and just do the job. Other than that, I'm trying to think what else is there that I don't enjoy about Aspen Dental.
That's the number one answer, by the way. If we were on Family Feud, that would be the number one answer. Everybody says the travel.
It's certainly a tough thing. Like I say, when I first started, during that first year, I probably had 5 assistants turning over, and so it's really difficult because then you're training someone new,
Sure.
and they have to really catch up. But once you find someone that works really hard and you pay them what they're worth, you give them bonuses, usually they stick with you, and if you're not a jerk to them, they usually definitely will stick with you. So.
So I think you know what my next question is going to be, but before that, somebody asked if you work 6 days a week. They must have jumped on a little bit later. Dr. Elliott, I think you work 4 days a week, right? You're typically off on Fridays.
I'm off every Friday. Now, some months, if an office is, just really, really busy and they need extra days, they might ask me to come in on a Friday and I'll do half a day in that office. But in general, I work 4 days a week.
3-day weekend every week. I'll take that.
It's great.
I'm sure your kids really like that. That's nice.
Absolutely love it.
Yeah. And so the last question that I like to end with every time is the exact opposite. It's a 2-part question. So what do you like the best about working for Aspen, and what advice can you give to any residents that are listening in about their career in general and if they want to come work for Aspen?
Absolutely. I think the thing I like the most really as a family person is the fact that I can come home every day and I'm not worried about what the office is going to be like tomorrow. I don't worry about running in any office. I just go in and I do oral surgery, which is what I'm good at. I'm not good at managing a business or marketing or any of that stuff. So I don't worry about any of that stuff. And really marketing myself, like going in and giving donuts to general dentists, and I really hated that part of oral surgery. And that's probably the biggest reason why I left private practice. More than, I know the whole partnership thing was an issue for me, but really it's more the marketing aspect of it where you have to go beg for patients to see. I absolutely hated that part of it. And I love that at Aspen Dental, I really don't worry about it. If I'm not at the office, then I can just be home with my kids and I get to just live my life. I don't have to worry about any of that. The money is much better. I was able to get out of, I came out with a lot of student debt. It was a lot. As I'm sure as most people coming out of residency or dental school have. But because of, the better compensation that I get here, I was able to get out of debt in 1 year, which is most people, I tell them that they just can't believe it. So the compensation is great. And the fact that you don't really worry about running a business, marketing and any of that stuff, I think that's really the biggest thing I love about Aspen.
Love it. Any advice for those who are listening in who are still in residency and they're kind of navigating the career path right now?
Absolutely. I think that, I was lucky because I was able to see both aspects of it. I was able to see what it's like to be a private practice oral surgeon. I was able to see what it's like to be an Aspen oral surgeon. I think if you feel like you're a confident guy or girl and you just want to hit the ground running and you know that you can do dental alveolar procedures, you can do some minor pathology cases, things that you do in the office, that's really mostly what you're going to be doing at Aspen Dental. If you're comfortable with all that stuff, you can certainly work for Aspen Dental. It's not brain surgery that we do, we just do the bread and butter things mostly, and that's that's for me that's what I love to do. So I think if you're a confident person and you know that you don't really require a lot of overseeing, you don't need anyone kind of watching over your shoulder. to make sure that you're doing a good job and you know that you can do anything you well, and you're providing a good service to your patient. I think there's no fear. I think you should be able to work at Aspen Dental right off, well, right after residency.
Awesome. It's 8:01. We finished up just in time. So thank you everyone who joined us. Thank you for your questions and your participation. Really appreciate it. It always makes these things go by much easier for us. I hope we were able to answer everything for you. If not, we'll definitely connect later on. And Dr. Elliott, thank you so much for doing this. You were awesome.
You can give anyone wants my email address, you can give that to them as well, and they can
Awesome.
shoot me.
Appreciate it. Yep. Thank you so much. And everybody have a good weekend. Cheers to Friday.
All right.
Have a good weekend, guys.